Thank you very much. And also I would like to thank to Robin for the comprehensive presentation about climate change impact on health, our health. Yes, climate change not only affect to environment, but also to health and health systems. IPCC, Intergovernmental Panel on Climate Change, emphasized that to limit global warming to 1.5 degrees Celsius can save millions of lives. However, minor temperature increase can cause severe catastrophic health consequences for our well-being. Climate change already impacting our health, leading to deaths and illnesses from severe weather conditions, storms and floods, extreme heat waves in Latin America, in global south, and it affects to increases vector-borne diseases, cardiovascular diseases, mental health issues, change in profiles of pathogens, and scale up of antimicrobial resistance and so on, and also it affects to increase spread of vectors like mosquitoes and ticks, which also create dengue fever, Lyme diseases, malaria, and also Zika virus. So it is very important here to analyze and understand the scale of and consequences of these health issues, health challenges in one, for example, areas. These climate-sensitive diseases are impacted disproportionately by vulnerable groups, vulnerable people with disabilities, disadvantages, women and children, migrants, then refugees, IDPs, and etc. For example, people living with HIV, they are also vulnerable group of people. So it is very important here to be ready for such health catastrophes, to be ready to make sure that we have enough health workforce. We have enough laboratories, hospitals, hospital beds, because we are here talking about finance at COP29, and it is equally important to finance health systems as well in the world. In global south, many countries suffer from without health systems, without any, for example, drugs, life-saving drugs. As parliamentarians, what we can do, we have a unique opportunity to propose laws, legislation, innovative, people-centered health services, solutions to our laws, our legislation. Then we have opportunity to also advocate to increase health budgets in national level, to increase, for example, budget for technology, for AI, because we are living in the 21st century, and technology develops day by day. So we can also apply artificial intelligence to health systems. In the health systems, we see here in one pavilion portable X-ray devices that weigh only 3.5 kilograms. So it is very easy to carry out them, and they also give the results. The AI gives the results, so you don't need any radiologists, any technicians can do it in remote areas, in the areas where there is no any doctors, there is no any health facilities. So technology is very important. As parliamentarians, we can also strengthen our efforts at an international level. For example, the countries make any commitments, sign declarations, health declarations, but it is equally important to integrate global pledges, global commitments into national level. We should include these goals to our national health strategies and to implement countrywide.
Parvana, you understand these issues extremely well. You know what the challenge is and what the opportunities are. I mean, as Robin pointed out, this is an unprecedented global threat, but it is an unprecedented opportunity also. Robin, you emphasize scientific cooperation, but Parvana, your superpower is that you are a member of parliament. So looking at the next step, so COP29 has provided a real impetus for the country to put climate change impacts and opportunities on the agenda. So given what you know about the health system in Azerbaijan, what would be the first 1, 2, 3 things that you would propose for a dialogue in the right committee, in the Milli Majlis?
Actually, I see there is a gap to financing health studies. We need to increase our budget to support R&D, research and development in health, because it is very important actually to have data, evidence-based data in the end. For example, in my country, there are some specific regions that climate change impact to health as well. For example, we observe that when we see the health data for 10 years or more than 10 years, we see that in one place the increase in cardiovascular diseases we observe. So there will be a linkage between environment, extreme heat waves, for example, with cardiovascular disease increase. So it would be good to have plenty of health studies in this point to analyze and understand the scale up and consequences of extreme heat waves or floodings in one region. We can choose pilot region, pilot area, and to analyze and to understand if climate change impacted on our health and which diseases scaled up, which disease burden scaled up in any specific areas. And also Azerbaijan have its own SDGs. Azerbaijan 2030 national priorities for social and economic development. We have here 2 priority areas that that targeted to improve healthy lifestyles of citizens and green growth and clean air and clean water and sanitation for our residents. And some ministries implement these priorities, these goals. And also Azerbaijan take new commitment to be co-convener of ATAC. Maybe you know about it. It is Alliance for Transformative Action for Climate and Health, ATAC. And this we will chair this alliance, co-chair this alliance for 2 years, 2024 and 2026. And Azerbaijan also invites all stakeholders to join these efforts for climate resilience future, as well as for low carbon sustainable health systems in the world. Also, today is Health Day within COP29. Together with education and children and youth. And there are plenty of meetings here, side events and high-level meetings about health. And third, global oral health climate change conference starts today. Our minister also will be here. So it is very important to take global commitments in strengthening health systems as well.
You're absolutely right. And these conversations are taking place in many different fora. There are the alliances like ATAC that you've just mentioned. Parliamentarians will have a role to make sure that once the COP circus has moved away, that you will be having hearings. So if you can shed some light on what the committee structures are like in the national parliament and whether any adjustment would need to be made so that these conversations can be taken forward with the right structure in place and with